verbalize everything.
Okay, before I get started, I am going to verify my orders here. So I have Mr. Tom Green, 66-year-old, Crohn's disease 3 months ago. My doctor's orders are saline sump NG for decompression with low intermittent suction. He has a distended abdomen and pain, nausea, so this is going to help, and I'm going to go do that right now. Hi, Mr. Green. My name is Whitney. I'm going to be your student nurse. How are you today? Good. Okay, Mr. Green, before I get started with anything today, I'm just going to first have you verify your name and date of birth. Tom Green. Your date of birth, 6/8/19XX. Awesome. And do you have any allergies? Betadine? Okay, that's what I have right here. So right now, your doctor has ordered to place an NG tube. Have you ever heard of an NG tube or had one before? Yeah, so it's a tube that's just gonna go up your nose and down your esophagus into your stomach. I know you've had a lot of pain down there. It's just gonna relieve some of that gas and that compression. We hook it up to suction and it pulls all those juices out and it'll help you feel a lot better. It's a little uncomfortable on the insertion, but it shouldn't be too painful, and we'll make sure that you're comfortable, okay? I'm gonna explain every step of the way, and if you have any questions, let me know. Do you have any questions right now? Okay, if you think of anything at all, just stop me and I'll answer your questions, okay? You put your bed up a bit.
Hi, Mr. Green. My name is Ellie. I'm going to be your nurse.
And I'm gonna put you into a high Fowler's position. Just raise your head a bit all the way. Okay, let me just gather my supplies. Sorry, your call light fell.
So, Mr. Green, what I'm going to be doing is
Let me get my tape ready.
have you ever had one inserted before? Do you know what that is? Okay, so an NG tube is a tube that I'm going to insert through your nose, down your throat, and into your stomach. And that is to suction out any excess fluid or air that could be causing abdominal pain and nausea.
Okay,
So,
right
hopefully
behind
this
you.
will be more comfortable. Here's your bed.
Okay, first thing I'm gonna do is I'm gonna measure this tube so we get the right length for you.
And then I'm going to make sure that you are in a high Fowler's position.
Okay, from the tip of the nose to the ear, all the way down just a little past the xiphoid process.
And then I'm going to go prepare my supplies.
So it's around 55 centimeters.
Oh, and I have my
Yep. I'm gonna mark that with my tape.
just in case, to check for coiling in the back of the throat.
Okay, and while I'm here, we're just gonna check and see which airway is better, which of your nasal passages is more clear. So I'm gonna have you just go ahead and breathe in. Good. Breathe in. Good. Which one felt more clear? This right one? Okay. I'm gonna just clean my hands and get some clean gloves.
Ready?
Grab the chucks while I'm at it. Okay, I'm just gonna set up my supplies.
I'm going to take my tube and measure it.
So this is just gonna lay here. It's just gonna catch any spillage or anything. Have my pH strip. Okay, and I'm gonna have my tongue blade and pen light ready to check for any coiling of the tube as it goes down if it gets stuck or something.
At about 60, but for the mannequin's sake, I'm ready to push it in a little further, so we'll give it
Okay.
tube it here at 70.
I'll lubricate this. Okay, so I'm all ready now. I'm gonna just insert it just a little ways, and then once I get past a certain point, I'm gonna have you lean your head forward and just lean to me and put your neck down. And then this is for you. It has some water in it. When I say swallow, I just want you to take a nice big swallow. Each time I tell you, it just kind of helps the tube move slowly down the esophagus, and just makes it hurt a lot less too. And if the patient were to start coughing, if I were to see any air in the tube, or if they experience any like chest pain, I'd immediately take out the tube because I don't want to be passing into their airway at all. Okay, we're about to get started, so I'm just going to go ahead and go. Okay, I would go into the nasopharynx. All right, I'm going to have you bend your neck forward and lean forward a bit, and with your cup, I'm going to have you swallow, swallow, swallow again, swallow, swallow. For the mannequin's sake, I'm going to go just a little farther. Swallow, swallow, swallow.